Hey everyone, good morning. It is Easter week of 2025, and this is one of the most popular weeks of the year for inductions, and it shouldn't be to anyone's surprise that that means also a greatly increased risk of a C-section this week. Easter week, Thanksgiving week, and Christmas week just are notorious for interventions when it comes to normal birth. So today I want to give you just a brief tip on questions that you can ask this week to make sure you don't fall into the trap of trying to get your baby out before Easter just for fun. So I want you to consider using an acronym called BRAIN, BRAIN. When you are being given the option for medical interventions in your birth, especially when you've been having a normal, healthy pregnancy, and all of a sudden we're having to talk about induction or even scheduling a section, you can use BRAIN as a resource on how to ask the right questions. So B stands for benefits. What are the benefits of the intervention? R stands for risks. What are the risks of this intervention? And although many times I hear of all the benefits of inducing or scheduling a section, you very rarely get the opportunity to talk about the risks. So be sure not to skip the R. A is alternatives. What alternatives are there to this intervention? For example, if you're being induced, you have the option of Pitocin or breaking your water, or maybe other options that are available in your area. So A is for alternatives. I is for intuition. And you can't discount this, mamas. We have an intuition when it comes to whether or not our babies are safe. And if a doctor or a healthcare provider is talking to us about applying interventions to our birth, and we've had a completely normal, healthy pregnancy, and all of a sudden we're having these uncomfortable conversations and somehow Easter comes up, you need to really look into your intuition and ask yourself, do I feel like my baby is at risk? Do I feel like this is an honest conversation? And do I feel like it's worth the risks of going to the hospital and being induced? And finally, the letter N, which is one of my favorites because it really makes you think. N stands for nothing, or really do nothing. So what happens if we do nothing this week? Can my induction wait till next week? If so, I encourage you to ask, is this a medical induction or is this because it's Easter week? Now, you have a lot to think about. I hope that helps you kind of sort through it. That BRAIN acronym helps my clients when it comes to making decisions in their birth. Good luck this week. I hope you guys stay pregnant and, let your babies pick their own birthday. I believe there's something sacred about babies picking their own birthday. Thanks for watching. Bye-bye.